Doctors who accept Medicare could face another pay cut in 2025, while the Medical Association is asking Congress to pass payment reform now. Today, I have Dr. Bruce Scott, Medical Director, or MD, excuse me, American Medical Association, and he's the president of AMA. Good morning. How are you?
Good morning. It's a pleasure to be with you to talk about this important topic.
And it sounds very important. What do Medicare cuts mean for you and your practice and your patients?
Well, for patients, the problem is they're having increasing difficulty getting appointments to see their doctor as wait times increase. And for physician practices like mine, we're struggling financially to survive. You see that Medicare has actually cut what they pay physician practices 29% since 2001. Can you even imagine getting paid almost 30% less to do the same job now that you were getting paid back in 2001? We all know that prices, costs of everything have gone up over the last 2 decades. And yet, on top of all of that, now the federal government is proposing another cut for 2025, despite the fact that they recognize that cost of providing care is going to go up. It's unsustainable for our practices. And at the end of the day, it's the patients who will suffer.
Definitely. Now, Medicare cuts impact seniors, but are there ways these cuts affect other patients too?
Oh, absolutely. These cuts affect all patients, not just those on Medicare. First of all, what's happened is all the insurance companies have recognized the predictable downward spiral of Medicare pay. So most of them have tied their contracts to the Medicare rate, resulting in a net reduction in what physicians are paid overall. The result of this is physicians have had to make difficult choices, not updating their equipment or laying off some of their staff, or in some cases, closing their practice altogether. There's estimates that we're going to face a shortage of 80,000 physicians over the next number of years. Now, it takes 8 to 10 years to train a new physician. And frankly, some of the physicians practicing right now, it may take only one more year of these cuts for them to quit, to close their practice. Estimates are that 1 in 5 physicians are actually looking to close their practice in the next 2 years.
Tell us about some of the AMA advocacy to stop another pay cut in 2025.
But the AMA is working with Congress because Congress has the ability to roll back this cut that is proposed to start in just a few weeks now, and at the same time to provide an update for physicians that will help us meet the cost of providing care. We're got right now a bipartisan group of senators and congressmen and women who are ready to support this bill. But we need the patients of America to speak up, to let it be known to their members of Congress how important this issue for them. They need to go to fixmedicarenow.org. And if they go to that website, what they're going to see is more information about the whole issue and how to contract their member of Congress in order to let their voice be heard.
Speaking of being heard, how can people help prevent another Medicare payment cut?
Well, they should talk to their neighbors and their friends. Ask people around you the difficulty that they've had in getting in to see their doctor, and then send that message to Congress. Make sure that Congress is hearing you. Go to fixmedicarenow.org and look at the resources that are there. Go on social media and share the story, share the issues that you're facing. Congress needs to hear us, and they need to hear you now.
One more time, where can we go for more information?
Fixmedicarenow.org.
I've been speaking with Bruce Scott, American Medical Association president. Thank you so much for joining us on Morning Blend. And I hate to say it, I think my sister-in-law and my brother have experienced some of what you've been talking about. Definitely.
Most patients have, unfortunately. Thank you for helping us spread the word on this important issue.
You're welcome, Dr. Scott. Thank you for joining us on Morning Blend.